Next up, Dr. Jaykrishnan, KT, Group Medical Director, Triyog Ayurveda. Dr. Jaykrishnan KT is a respected Ayurvedic expert committed to integrating traditional healing practices with modern healthcare approaches to promote holistic wellness and preventive care.
I'm Dr. Jaykrishnan, Group Medical Director, Triyog Ayurveda Hospital. Triyog Ayurveda Hospital is a group of hospitals started from Chennai. We are trying to spread across India. We have 2 branches in Hyderabad, one in Khammam, one in Vizag. We are trying to expand further. In this context, I would like to tell you something about how we are trying to spread the ancient knowledge of Ayurveda, or rather the classical knowledge of Ayurveda, with the proper incorporation of the latest advancements made in the medical science. We all know that ancient knowledge in India was valued very much in all fields, especially in the health field. This comprehensive knowledge of health of an individual was valued very much. We are trying to bring it back. That many areas where there is no direct solution across the world for very many health issues, we are trying to see that the old way of looking at an individual, addressing the individual in total, is still possible in the present day without compromising any kind of advancements in the medical systems. So what we are trying to say is that according to Ayurveda, the individual is considered not as a single physical entity. Physical body is there, which is functioning according to how the mind is functioning. Through the mind, the nervous system is activated. Through the nervous system, the body is conducting its normal functions. So whenever any function of the body is impaired, the weakness of the structure or the degeneration of the structure is calculated, and we try to ensure that the structure is regenerated through the natural means, or weakness of the structure is addressed, nourished through the natural means of food, herbal products, combinations of herbal products, food, activities, and balancing the emotional plane of the mind. Through all these things, we are sure that the structural health can be replaced and regeneration can be done to almost all the structures. Nowadays, everybody knows that even the nervous system can be regenerated as per the latest knowledge. So we also say that most of the diseases, any structure can be regenerated so that the impaired function can be restored, plus an emotional balance also have to be re-established to see that we have addressed one disease. Second thing is that as per our understanding, each individual is physically itself different. We know that the new branch of pharmacogenomics developed very strongly in the Western countries, because one antibiotic is not working for all the people for the same disease. For us, it is like that disease may be same. Our concern is why this individual has developed this disease. So we will be trying to find out the causative factors to the physical plane as well as the mental plane. So physical plane itself is different for different individuals, then mental plane definitely will be quite different for different individuals. But we can generalize it, we can work on that plane and gradually ensure that there is a healthy physical structure established in spite of addressing the direct symptoms. Beyond that, we address the physical health also through natural means. Then mental, we don't have what is a fixed definition for what is a mental health. In simple words, if you say that, if you feel comfortable with your own mind, you are healthier there. you feel relaxed, you feel comfortable, you feel happy with your own mind, then you are healthy there. Such a awareness, there is no medicine for the mind. To our understanding, mind is metaphysical, not physical. So physical medicine will not be going there. Whereas an awareness of your own mind can be created, with which you can make a healthier mind also. Emotional balance also can be created, which will be contributing very much to the well-being of the physical plane. We know that anorexia, nervosis and all, you can have a loss of appetite just because of the depression or any disturbance in the mind. Where an appetizer will not be working, hyperacidity will have a direct connection to the anxiety. Anxiety can have a direct connection to the hyperacidity. So we know that every physical plane, the deepest part is the mind, and which is very strong also. That also has to be calculated nowadays and taken into consideration while dealing with any diseases. Third point I wanted to say is that as per the contemporary science, number of diseases are I think around 1320, around that. So far they have found out that much disease, including COVID and Ebola. To our calculation, the possibility of number of diseases are innumerable, because the dysfunctions and impairment in the body you can't predict. It can be in different ways. So the possibility of a disease formation is innumerable. So you can only do what comprehension you can make. What is a basic change, what is a difficulty basically happening to the body. So you are bringing that innumerable possibility to your level and work in that plane and see that basic health is re-established through natural means. Natural means first thing is food. Your body is what you are eating. So good or bad, you need to look into your food. So food can be corrected according to our understanding of food, medicine, and then activities and emotional balance. These things can be done. This is the old way of dealing with I think health issues. You know that in Western countries still they are trying to revive the family physician concept. Disease is not a single entity. It can be a continuation of what has happened in your childhood. So somebody who is leaving a private practice is supposed to hand over the details of the patient to the next doctor, so that you get an entire history of individual where you can interfere as and when needed to see that his health is re-established. So that is one thing. And there is also a wrong notion among the public that Ayurveda is more about wellness and prevention. Wellness of your health and preventive health care. There is wellness in Ayurveda, there is a preventive aspect in Ayurveda. Equally strong is the curative aspect of Ayurveda. Like any other medical system, all diseases can be dealt, or rather that was a practice maybe 100 years, 200 years back. This is almost 5,000 years old healthcare system, where an individual is considered in total, even in connection to the nature or the society at large, and the entire management of an individual issue will be reflecting in the society as well. So individual is well maintained, society is well maintained, that is good for the entire country. That decides the health of the country. I think we are trying to revive that old mode of creating a patient-centric health without compromising in any advancement in the science. Like you know that surgery or emergency medicine, there is a lot of advancement. Those understandings can be well conceived by this Ayurvedic field. At the same time, without compromising the basic understanding of Ayurveda, we are trying to establish this kind of a patient-centric healthcare system across India. Thank you. That much from our side. Thank you.
India's most influential Ayurvedic healthcare leader 2026 award goes to Jaykrishnan, Group Medical Director, Triyog Ayurveda. May I kindly request Dr. Jaykrishnan to please come up and receive this prestigious recognition for his contribution and outstanding leadership in Ayurvedic healthcare, remarkable contribution to holistic healing.